morning everyone. Today we're going to learn to identify the foramens of the skull. Here we have the cranial fossae. As shown in this diagram, the cranial fossae can be divided into anterior, middle and posterior cranial fossae. So let's see the foramens present in each one of them. Here in the anterior cranial fossae we have foramen cecum, anterior ethmoidal canal and posterior ethmoidal canal. In middle cranial fossae, we can see superior orbital fissure, optic canal, foramen rotundum, foramen ovale, foramen spinosum and foramen lesserum. Turning to posterior cranial fossae, we have internal acoustic meatus, jugular foramen, hypoglossal canal and the foramen magnum. Coming back to anterior cranial fossae, the cribriform plate shown here separates the anterior cranial fossae from the nose. The foramen cecum transmits the emissary vein from the nose to the superior sagittal sinus. Anterior ethmoidal canal transmits the anterior ethmoidal artery, vein and nerve, whereas posterior ethmoidal canal transmits the posterior ethmoidal vessels and nerve. Again, in the middle cranial fossa, optic canal transmits the optic nerve and the ophthalmic artery. The superior orbital fissure has got a lateral part, middle part and a medial part. The lateral part transmits lacrimal nerve, frontal nerve and trochlear nerve. The middle part transmits oculomotor nerve, nasociliary nerve and abducent nerve, whereas the medial part transmits inferior ophthalmic vein and sympathetic plexus around the internal carotid artery. The foramen rotundum is the foramen which transmits the maxillary nerve. The foramen ovale transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve and the emissary vein connecting cavernous sinus with the pterygoid plexus of veins. The foramen spinosum transmits the middle meningeal artery, middle meningeal vein and the meningeal branch of mandibular nerve, that is the nervus spinosus. Last but not the least, foramen lesserum transmits the meningeal branch of pharyngeal artery. Moving again to posterior cranial fossae, the internal acoustic meatus transmits the 7th and 8th cranial nerves and the labyrinthine vessels. The jugular foramen has got an anterior part, middle part and a posterior part. Anterior part transmits the inferior petrosal sinus, sigmoid sinus and the meningeal branch of ascending pharyngeal artery. The middle part of jugular foramen transmits the 9th, 10th and 11th cranial nerves. The posterior part of jugular foramen transmits the internal jugular vein and the meningeal branch of occipital artery. As the name suggests, the hypoglossal canal transmits the hypoglossal nerve. Finally, we have the foramen magnum. Through the anterior part of foramen magnum, the structures that pass through are membrana tectoria, cruciate ligament and apical ligament of dens. Through the subarachnoid space, vertebral arteries, anterior and posterior spinal arteries and spinal accessory nerve. Through the posterior part of foramen magnum, lower part of medulla, tonsils of cerebellum and meninges. So, it would be better to summarize once more. In the anterior cranial fossae, we have foramen cecum, anterior ethmoidal canal and posterior ethmoidal canal. In middle cranial fossae, we see superior orbital fissure, optic canal, foramen rotundum, foramen ovale, foramen spinosum and foramen lesserum. In the posterior cranial fossae, we have the internal acoustic meatus, jugular foramen, hypoglossal canal and the foramen magnum. This is the diagram of the cranial fossae given in Chaurasia. So now, I hope you all are able to identify the foramens here. The foramen cecum, anterior ethmoidal canal, posterior ethmoidal canal, superior orbital fissure, optic canal, foramen rotundum, foramen ovale, foramen spinosum, foramen lesserum, internal acoustic meatus, jugular foramen, hypoglossal canal and foramen magnum. Here we see is the norma basalis of skull. A few more foramens are there which should be known by all of you. Just a few more ones. This is the carotid canal. The carotid canal transmits the internal carotid artery along with the venous and sympathetic plexus around the artery. Next one, the stylomastoid foramen, which transmits the facial nerve. Moving downwards, we have mastoid foramen. The mastoid foramen transmits the meningeal branch of occipital artery and the emissary vein connecting sigmoid sinus with posterior auricular vein. Finally, we have the condylar canal. This is the posterior condylar canal. The anterior condylar canal is nothing but the hypoglossal canal. Through the posterior condylar canal, the occipital emissary vein connects to the venous system, including the suboccipital venous plexus, occipital sinus, and the sigmoid sinus. So, again, summarizing the remaining foramens, we have seen carotid canal, stylomastoid foramen, mastoid foramen, and the condylar canal. So, that's all for today. Thank you.